Gian na po.
Ayan, toxicology, national activity na.
Opo.
Sige, pagkatapos ng video, stop na tayo. Again, pagkatapos ng video, art, read, and announce. Art.
Yes po.
So, pagkatapos ng video, read na, welcome, Akbala, Toxology National Anthem. Tapos, welcome to our class. Welcome to art. Tapos, production, speaker, na,
Ganda ng dingding.
Marga, wala si Marga. Okay, ano naman si Marga, oh. Tapos si Ma'am Kat, Vincent, pag nag-open forum na si Ma'am Kat, alahanan. Okay na, ready na? Last 20 seconds. Okay. Live in 3, 2, 1.
Magandang umaga sa lahat ng mga nanonood mula sa ating mga tahanan at sa ating Facebook Live and Zoom. And welcome to our virtual AstroCHATS. My name is Mark Yao and I am your host for today. Let us begin our program by the doxology brought to us by Teatro Rizalia and the singing of our national anthem by our project assistant, Miss Franche Castillon.
wala siyang sounds.
Mga kababayan, ang pambansang awit ng Pilipinas.
And again, magandang umaga sa lahat ng mga nanonood mula sa ating mga tahanan. Sa mga nanonood sa ating Facebook Live, please share the video para makita pa ng ating mga relatives and friends. So ano nga ba ang AstroCHATS? Since 2016, AstroCHATS presents delicate multidisciplinary short talks from different professionals around the globe. It aims to provide free knowledge and ideas to the Filipino people on the diverse relationship of astronomy in the fields of arts, sciences, technology, and our everyday life. This year, AstroChats goes virtual. So please stay tuned because we will be providing you with weekly dosage of chats from our esteemed resource persons. To formally start our program, let's give a virtual round of applause to the Program Officer of the Center for Astronomy, Research and Development, Professor Ryan Manuel Guido.
Hi. Morning. Naimbag nga bigat, maayong aga, marhay na adlaw, maayong buntag, maupay nga aga, maayong nga aga. To our esteemed guest resource person, Dr. Marvic John Alcantara, to our guest faculty, researchers, students, and to the community. So we hope that everyone is well and safe. The center prepared a series of webinars for everyone in the field of astronomy. The series of Saturday events is a way to reach out to students and to the community. This year's AstroChats aims to express the diversity of astronomy, its emerging interrelationships with other branches of knowledge as time goes by. The center believes and acknowledges that astronomy sprouts and has established interrelated approach to the different fields such as sciences, mathematics, arts, culture, and social sciences. So hope you stay with us not only in this day, but for the next Saturdays to come. Thank you, everyone. Have a nice chats and keep safe, everyone.
Maraming salamat po, Professor Ryan, for your welcome remarks. And now, to formally introduce our resource person for today, we would like to call on Mr. Jason Calao from the Center of Astronomy, Research and Development.
Thank you, Mark. Good morning, everyone. Our resource person for today finished his Bachelor of Science in Nursing at the Manila Doctors College of Nursing, Manila Titana Colleges in 2012. He worked as a cardiorespiratory nurse from 2013 to 2015. He also attended he also attended the Norwich School on Exoplanet and Astrobiology in Chiang Mai, Thailand 2019. A year after, he graduated with a degree of Doctor of Medicine at the De La Salle Medical and Health Science Institute. He is currently a postgraduate intern at the De La Salle University Medical Center and at the same time taking the Master of Science in Astronomy at the Rizal Technological University. He is also reviewing for the medical licensure examination for next year. We're also glad that our resource person is now a part-time professor at the Department of Earth and Space Sciences, Rizal Technological University. Let us all welcome Dr. Marvic John C. Alcantara.
So good morning. Welcome to our AstroCHATS in Vermont. So today I'll be discussing space physiology and anatomy and incorporated some topics about space medicine.
Ayan, PowerPoint.
So let's start. Next slide, please. So our topic for today will be these four. First, a brief history of space medicine. So next is how to be a space doctor or what are the credentials. The next is common medical problems encountered by the astronauts. And lastly, the contents of space medicine kits. So next slide, please. So for an introduction, again, space medicine is a branch of medicine that focuses in supporting human space exploration. Next slide, please. So, quote unquote, if someday rockets should open the gates to space, then we must be oriented as to its environmental conditions and possible biological effects to study these and to find the means of protection of is one of the tasks of space medicine, quoted by Hubertus Struggle. So next slide. So who is Hubertus Struggle? So he was the first one who coined the term space medicine. He was a Nazi physician and a physiologist brought to US after the World War III. So there are the pioneers of space medicine in US. So he also worked on the development of pressure suits, which is worn by the early astronauts in the US. So next slide, please. So this is astronaut Joe Kerwin. So he was the first physician who was brought to space. He was examining Commander Pete Conrad. This is the project of Skylab Medical Facility. So next slide, please. So how can one be a space medicine or a space doctor? So next slide, please. So of course, first you have to be a graduate of degree of medicine. So afterwards, you will proceed to your specialization or residency training program. So in space medicine, they are requiring not a specific field. They are open for internal medicine, emergency medicine, surgery, what else? And also family medicine and ophthalmologist. Or other track, you can try to enter military first, US Navy or US military. Then afterwards, you will proceed your fellowship training in aerospace medicine. And as follows, you will be a citizen in their country. So next slide, please. So where to apply? So you can check American Association of Medical Colleges. They put it there the links of universities that accepts fellows or residency training program for aerospace medicine, namely University of Texas, Wright State University, Medicine in Dayton, Ohio, Aerospace Medical Institute in Pensacola, and Baylor College of Medicine. And in year 2016, United Kingdom opened their field of space medicine in University College London. And you can also check for projects in Project POSUM. They have space doctors there who offers training and seminars. So next slide, please. So what are the other trainings for being a space doctor? So this is the vomit comet. So this is one of the training. Also, this is a flight where the pilot flies into a zero gravity in a parabolic state. So this has an interval of 20 to 25 seconds in which you will be trained on how to manage yourself in a zero gravity. Next slide, please. So I will show you a video regarding the vomit comet. Please skip to 2 minutes. Here we can see they are orienting the persons or the people who will try the vomit comet. Not only the astronauts or space medicines can avail these videos or I mean this training of the vomit comet. You can try this. They are commercially open, but you will. I think the price is around $5,000 to $7,500 for 7.5 minutes of zero gravity. So there they are orienting. So as we can see, not all of them are astronauts. They just want to try the experience of zero gravity. So in this scenario, the doctors are trained to do appendectomy and cholecystectomy. They are practicing in the zero gravity, also doing other medical procedures, giving medications, and assessing what happens to the body when you're in zero gravity. So there, few minutes before the flight. Now the planes enter the parabolic state. Now you will see what happens in zero gravity. now they're floating. As you can see, there were trainers also that guides them. So next slide, please. That's the 7.5 minute ride. So next slide, please. So first thing it comes in mind when you're dealing with space medicine or questions in space, how to perform CPR in space. So here in Earth, we're doing it like what the picture shows. So have you have any idea how they do it in space? So next slide, please. I'll show you a video on how they do CPR in space. So they do it vertically, and the force comes from your lower extremities. So this is important in case there's an emergency in the International Space Station. So next, what are some of the medical problems in space? So next slide, please. So let's discuss this one by one. First, the intracranial hypertension and visual impairment. First, there are several factors that contributes to this problem. First, the speed of the launch of the rocket. Knowing the speed is around 17,600 miles per hour, so the fluid shifts from the normal homeostasis shift to a different level. So in Earth, so the normal fluid circulation, especially the blood, so the heart pumps to the brain and to the different organs up to the lower extremities and it goes back. But when you're flying to a zero gravity, the fluids shifted upwards. So all of the fluids are concentrated in our head, in our brain, in our skull, and some are concentrated in our upper extremities. So that fluid concentrated in our skull causes the intracranial hypertension. So it means the fluid, so our skull, it doesn't expand. So when the fluid increases, the tension there increases. So some of the organs are damaged, like the eye. So some of the astronauts experience visual impairment. There are studies that done by the professionals in NASA, wherein they tested 108 astronauts. 22% of them experience flattened eyeballs, which causes visual impairments. So next one, sleep disturbances. As we know, they sleep in a different manner in space. It is like sleeping when you are floating in water. So that is how they sleep in space. So next one, this is vestibular dysfunction. Vestibular dysfunction, this is correlated with the motion sickness. So what is motion sickness? This is experienced 50% of the astronauts that fly. So vestibular dysfunction, so this is the problem in what the eyes see and what the ears feel. So like in daily driving, when you're a passenger, like when you're reading a book, so you're not focused on the road, right? So but your ears can feel that the bus is turning left, the bus is turning right. So what is our vestibular system? So inside our ears, there is a three semicircular canals which can sense the rotation of our surroundings in different axes, x-axis, y-axis, and z-axis. Another one, we have two hairline fluid-filled sac, which also recognize your position vertically and horizontally. It is called the utricle and subsaccule. So this vestibular system is the one who says what are in your position. That's why the astronauts experiencing motion sickness. That's why if you check some videos in the internet regarding NASA flights, they have emergency vomit pocket because most of them experience vomiting during the space flight. So next is the orthostatic next is orthostatic intolerance, meaning orthostatic meaning the body is not adjusting to sudden change in position because of the proprioception. So what is proprioception? So we have sensory organs in our muscles, tendons, and uh, ligaments. So in space, we know that we are floating. So our muscles are not that efficient in detecting our position. So next, behavioral changes. So and burnout. This is one of the. These are the problems encountered because the duration of flights and most of them are exposed for more than 100 days. So next is reduced aerobic capacity and reduced muscle mass due to the gravity. Uh, the muscles, especially in our lower extremities, are not used. So it became due to the loss of and that leads to reduced muscle mass. Sorry. So inadequate nutrition. So but this one are resolved by the nutritionists of the astronauts. They are given with specific nutritionists for their specific diet. So bone loss and fractures, we'll discuss this later. Intervertebral disc damage. So in cardiac rhythm problems, as I have discussed before, there are problems with fluids. So what happens? All of the blood stays in the heart. No, not all. Most of the blood stays in the heart. So what happens in the heart is it doesn't need to pump more because the body doesn't need that more blood in our lower extremities. So what happens in the cardiac muscles? It inflames due to the fluid overload. So last one, the renal stone formation. So because of the fluids availability in space, they are high risk of developing renal stone formation. So also, we know that the coffee for Monday will be their coffee for the next day because when they urinate, the urine will be just recycled and turned to a clean water, and then it will be their water the next day. So another one, the most popular physiologic and anatomic changes in an astronaut is the puffy face and chicken leg. So the puffy face is correlated with the fluid shift, and the chicken leg is for the disuse of the muscles and bones. So next slide, please. Next slide, please. So we'll discuss in detail about the bone problems in space. So next slide. So let's review. First, there are three important cells in the bones, namely osteoblast, osteoclast, and osteocytes. So our bone serves two important functions. One is to provide a rigid structure needed for the movement and activity, and the other, it serves as a reservoir for calcium within the body. So the balance between these three, osteoblast and osteoclast, and osteocytes, affects the bone activity, no, the bone stability on space or even in Earth. So next slide, please. So what are the factors to be considered in space that affects our bone? Next slide, please. So first, the dietary calcium, low light levels, high carbon dioxide. Next slide, please. So next slide, please. So first, let's discuss the dietary calcium. So the recommended daily intake of calcium is 1,000 milligram per day for men and around 1,000 to 200 for women, depending on age group. So what happens if the calcium intake drops below 400 milligram per day? So it results to calcium deficiency. So with calcium deficiency, serum calcium can fall and in turn, it will stimulate the body, the parathyroid hormones, to increase. So what does the parathyroid hormone do? So in turn, it works at the different sides of the body to increase absorption, namely intestines, kidneys. So it reduces calcium excretion to restore the calcium levels. So also, one of the functions of the parathyroid hormone is to convert the activated form of the vitamin D. So next slide, please. So again, low sunlight levels, because as we know, the International Space Station is traveling against the sun. So what does the sun do to us? So the sunlight is important to activate the vitamin D so it can mineralize the bone faster. So what can we remember is the pairing. So when we hear calcium, we should have vitamin D and phosphate. So sun exposure too is especially important to activate this vitamin D. So next slide, please. So high carbon dioxide. So carbonate or the products of high carbon dioxide levels, it will cause acidity in the body. So acidity in the studies, it affects the bone resorption by increasing it. So bone resorption means bone destruction. So also, this high carbon dioxide level will increase the risk of the astronauts in developing kidney stones. So these are the levels of CO2. The CO2 levels on Earth is around 0.3%. So in space station, they have their own levels of CO2, which is controlled by their system. So, but the levels are increased from levels on Earth of 0.03, they are increased to 0.7 to 1%. So this is one of the risk factors for bone problems. So next slide, please. So what are the factors that contributes to bone formation? So it means this is favorable for a better development of the bone, namely the good calcium intake and other dietary factors, and mechanical loading, meaning exercise, walking, and the favorable for bone resorption or bone destruction is immobilization, and also dietary factors which highly contributes to bone resorption. So next slide, please. So in years of space medicine, they have studied that most of the bone loss is concentrated in the lower extremities. As we can see, most of the higher percentage are seen in the lower extremities, namely the tibia, calcaneus, the greater trochanter, the pelvis, and the femoral neck. So what they do, they to counter this bone loss, they did made a program that gives a heavy mechanical loading for the bones. So what they did was around 1,400 to 2,500 for the lumbar spine and 2,000 to 3,000 newtons for hip and 1,500 to 2,000 newtons for the calcaneus. So they studied that these weight bearing exercises would help will help to prevent the bone loss in space. So next slide, please. So these are the exercises that the astronaut does in space to counter the bone loss. So aside from the bone problems, we also have muscle problems that leads to muscle atrophy. Muscle atrophy meaning the mass of the muscles are lost due to inactivity. So what are the important muscles to remember? So in standing here in Earth, we have to remember the 5 muscles. First one, the erector spinae muscle. So the erector spinae muscle is located around our spine. So the erector spinae muscle is in charge with the straightening of the spine together with the intrinsic buck muscle. So next muscle is the ellipsoas. So this muscle protects the hip joint. So together with erector spinae and the ellipsoas, imagine that you are standing. These muscles balance the forces that implies from the back and from your surface. So next, we have 2 muscles. So we have the next 3 muscles, the quadriceps femoris, that is one of the muscles being affected. So that's why, as you can see in the picture on the right side, this is very similar to deadlift here in Earth. So next muscle next muscle group is the hamstrings, namely semitendinous, semimem, and the 2 biceps femoris, the long head and the short head, and lastly the soleus. So these 5 muscles are important for the body to stabilize standing straight. So in gravity, these muscles are not used because of free floating in zero gravity. So the atrophy will be high risk, high chances in this case, in these muscles. So what are the factors important in these muscles? So like the soleus, it has type 1 muscle fibers. So what are the type 1 muscle fibers? These are the slow twitch muscles which contains myosin heavy chain. So meaning these muscles are not easily fatigued, so it can withstand force. So aside from it, these muscles are assigned for our steady posture. So that's why those muscles are important because of these types of fiber. So next slide, please. I will show you some of the exercises how to counter muscle atrophy and disuse osteoporosis. Next slide, please, for the video. So they provided certain exercises to counter these measures. Also, as you can see in the video later, we have this treadmill exercise. They call it the bungee treadmill exercise, which is the astronaut is placed in a harness and in a bungee attached to the treadmill. So this bungee would exert more pressure in the muscles, so it will prevent more muscle atrophy. So are we ready with the video?
Doc Marvic, paantay lang po sa video.
Sige.
Sorry.
So that's the example of the bungee treadmill exercise. So as you can see, there's the settings in her laptop, so she can adjust the weight because the program of their exercises is very similar to our program here on Earth. So on your first few days, this is you will start on your baseline weights. So in the next few days, you will add more weights to strengthen your muscles. So as you can see, so the treadmill is like floating. This is a specialized treadmill designed by the engineers. So the impact of the running won't affect the space station. So it's like you're running and floating at the same time. So that's the harness. So she is adjusting the weight. I think in this video, it's her second month. So the weight that she is using is kind of heavy now. So that's the chain. So that will be the deciding factor for the weight. So now she is adjusting the program. So all of these exercises is recorded and sent back to our command center here on Earth because together with these results accompanied. Okay, let's watch the video first. So the duration of the exercise they're doing in space is around 2 hours. So 30 to 1 hour for treadmill exercise and 30 minutes also to 1 hour for weightlifting activities. So in here, they also document their vital signs for monitoring. So that is how we run in a bungee treadmill exercise. So next slide, please. So aside from physical problems encountered in space, so the astronaut also experienced psychosocial problems, namely depression, anxiety disorders, asthenia, person control centric conflict, meaning sometimes there's a project headed by the Russians, so some of the other nationalities is having problems with the commands of the leaders and also person-to-person conflict because astronauts are diverse. So not all angry astronauts tend to talk too much. Some are just silent. So you can predict whether they're angry or not. So these are the problems encountered. So what are the measures that the space doctors does to prevent these events? So next slide, please. So these are the steps or the methods how the doctors prevent these events. So conflict resolution training. So before flying, there were simulations and trainings that prepares the astronaut in dealing with other persons. So other one, the problem solving therapy and psychological support program. So the psychological support programs, this is where they've allotted time for a video call for the astronaut's family. So they incorporated the medical examination or medical checkups with the families, talking to them around. I think they can do it weekly, depends upon the situation. So there are also medications to prevent depression. So next slide, please. So our next video will show how the astronauts do EVA. So what are EVA? So EVA stands for extravehicular activity, or also known as the spacewalk. So there are problems encountered in spacewalk. So that's why they planned it carefully to ensure the bodies of the astronaut is properly stabilized, even with adequate materials, footholds, and good muscle strength. So they are preparing for this months of preparation, because as we know, all of the activities in space are concentrated in our upper extremities. So next slide, please. So again, EVA, the spacewalk. So there are several problems encountered in spacewalk. So thermal problems due to the environment and the spacesuit. But the most important problems encountered by the astronaut during EVAs is decompression sickness. So what is decompression sickness? So the decompression sickness happens when the pressure inside your body and the pressure outside the body suddenly changes. So like in divers, when they go to the surface they go to the surface from deep quickly, they experiencing the decompression sickness. So what happens in the decompression sickness or DCS? So in DCS, as the altitude increases, the nitrogen levels increases. So the nitrogen levels increases in the body. So what happens when you accelerate faster? So these nitrogen molecules turns to bubbles, and these bubbles in turn will go to different parts of the body, causing the bends or the decompression sickness. So what happens in bends is muscle pains, joint pains, and some of these nitrogen bubbles are fatal because it can travel to the heart, to the brain, and to other different vital organs. So we have two classification of decompression sickness. DCS1. DCS1 affects only the joints and muscles. So what the space doctors are afraid of is the DCS2, or the decompression sickness 2, because it affects the vital organs. It may cause heart problems, or even cardiovascular stroke. So what are the preventions we can do to prevent this decompression sickness? So what they found out in research, the astronauts should be oxygenized for about 1 hour or more by a high pressure oxygen, about 3 times of a normal pressure oxygen delivery here on Earth. So by this method, we are like delivering backup. So we are like delivering backup oxygen to neutralize the high levels of nitrogen will occur during the space walk. So here on Earth, what we can do for the divers experiencing DCS is, aside from oxygenation, we have here our hyperbaric chambers. Hyperbaric meaning high pressures of oxygen delivered. So it is the same maneuver given, but we don't have hyperbaric chambers in space. So what we can do in space only is to pre-oxygenize the astronauts and afterwards monitor again, and so we will monitor again and give oxygen again. So that is one of the most important problems encountered in spacewalk. So next slide, please. So medical kit in space. Next slide. So what are the contents of our medical supplies or medical kits? So this is the SOMS, or also known as Shuttle Orbiter Medical System. So the SOMS consists of 2 separate packages. One is medications, bandages, and the next one is the emergency medical kit. So first, let's discuss the medications first. So here in the medications or the MBK medications kit, so it contains capsule medications, tablets, and suppositories to support the daily lives of the astronauts, because they also experience cough and colds. So they can give other medications like diphenhydramine. So, but they are very careful with this because some medications can alter the sleep patterns of the astronauts. So, aside from the medications, they have bandage materials, and topical medications, because one of the problems encountered is skin injuries, especially in the fingernails, because not all designs of the spacesuit specifically fitted for the astronaut. So sometimes when they are wearing it rapidly, so they tend to scratch their fingernails, also their fingernails, also their skins in the hands. So there are topical medications provided. So what are the contents of the emergency medical kit? So in our EMK, so they have emergency medications like for heart arrest, for severe allergic attacks. So they are provided. So also they are trained to do or to perform minor surgeries, like what I mentioned. In cases of appendicitis, they are ready to do appendectomy there in space. They are also microbiological test kits to determine what bacteria causes the cough or pneumonia of the astronauts. So next slide, please. So what are some of the contents? So next slide. So they have needles also in the space station, but as you can see, it is well capsulated to prevent further injuries. So next slide, please. So these are the contents. I got this from the 2015 list of the medical kit. So they have the convenience medication pack, emergency treatment pack, so IV supplies. So as you can see, it is color coded for easier identification of the paraphernalias. So next slide, please. So as I mentioned, the astronauts are experiencing psychosocial problems like depressions or anxiety. So they ordered antipsychotics. So these are the antipsychotics contained in some of the medical kits. So as you can see, most of them causes dizziness, drowsiness. So when the astronauts take this, so they are closely monitored because these medications will affect again their circadian rhythm. So next slide, please. So again, so the goal of space physiology and medicine is not only to care for the astronauts, to prepare them in space flights, but to also to teach them how to be independent, especially in 2030, the NASA plans to transport human in Mars in a one-way trip. So the Space Physiology and Medicine Department of NASA prepares the astronaut how to treat basic illness like fever, cough, also taking their own vital signs uh, in preparation to live alone in Mars. So we've discussed different factors in space. So the psychologic, physical, and the other contents. So next slide, please. So thank you. Here are my references. Next slide, please. Thank you for listening.
Ah, maraming salamat po, Dr. Marvick. Truly, he is one of the best in this field. Again, thank you, Doc Marvick, for your
Thank you, thank you.
remarkable presentation. Let me just share some of my major takeaway from this chat. Let me begin with why do we really need a space doctor? Isa po ito sa mga natackle ni Doc Marvick. We have tackled on how the space doctors were trained in the zero gravity environment through the program by Vomit Comet, in which they mimic having no gravity in a short period of time. Aside from this, since we are not very familiar with having no gravity, ano nga ba yung mga common problems na nai-encounter sa space ng mga astronauts, such as visual impairments, reduced muscle mass, cardiac rhythm problems, bone problems, at napakarami pang iba. We also encounter different bone problems kasi nga walang gravity sa space. Doc Marvick mentioned different forms and types of workout in space like the bungee treadmill exercise. There are also mental problems that occurs like depression, anxiety disorders, person-to-person conflicts, at marami pang iba. Meron din, natakal din po ni Doc Marvick ang shuttle orbiter medical systems na ginagamit ng mga doctors, such as the medications, mga suppository, tablets, and other gamit para matreat yung mga normal sickness like coughs and colds. Meron din sila mga dalang bandages, topical medications para sa mga skin injuries and mga allergies. At meron din silang emergency medical kit for severe problems. They can also do minor surgeries in case of appendicitis, microbiological tests, and dito niya po tinapos yung kanyang talk. Since we are preparing to live in Mars, or at least send people in Mars, ay bakit nga ba natin kinakailangan ng space doctors at bakit tayo nagtitrain ng mga space doctors? And ayun po. In addition, we would like to request the participants to answer the evaluation form in order to have a certificate for today's AstroChats. The link is in the Zoom chat, and we will also post it in our Facebook page, facebook.com/Center for Astronomy Research and Development. And now, we will be proceeding with the open forum. Kung may mga questions kayo or inquiries regarding the presentation of Doc Marvic na napakaganda, you may post it in the chat box of Zoom and in the comment section of our Facebook Live. Let's hear some of the questions from our audience through Professor Ryan.
Hi, good morning.
Hey, good morning, sir.
So we have questions po from our Zoom. We would like to acknowledge the presence of Dr. Armando Lee, the first graduate of MS Astronomy, Rizal Technological University.
Good morning, Dr. Lee.
Ayun. And my question po
Morning, everyone.
ang question niya is for Doc Marvic, is the Philippine Space Agency already looking for space medicine specialists for their space program? Is there even a space program by PSA needing space medicine specialists?
Yes, sir. From what I have attended, a lecture from the PSA or the Philippine Space Agency. So for now, they are only recruiting for admins, position for admins only. So they are not recruiting yet for space medical backgrounds for now.
Okay, sir. Next question po ni Dr. Lee, what will it take to have a space medicine specialty training program here in the Philippines? What kind of curriculum and what facilities needed to have such training program?
So curriculum first. So we can handle the curriculum because in medicine we have ample amount of time in discussing physiology and anatomy. Also in the diseases, we have allotted for about 3 years to discuss these diseases. So what we need is some doctors to be trained so they could start our space medicine course here in the Philippines. So for the materials or equipments, so one of the important equipments is first the hyperbaric chamber because we will be needing a large swimming pool. So this large swimming pool will be the training grounds for our possible astronaut trainees. This is where we simulate how they spacewalk and everything. So those are some of the materials or the gadgets we are needed. Also, we are also needing some portable devices like a portable MRI because there are studies ongoing now. They are using portable MRI with the size of around size of your Apple tablet. So they are practicing using that MRI now in zero gravity, the efficiency of that MRI. So those are the materials we are needed. So aside from it, we should also have the exercise modularities needed or similar to what they do in space. So the treadmills and the weightlifting. So we have to have that here in the Philippines, sir.
Okay, thank you, Doc. Another question from Dr. Lee ulit.
Yes,
Do you think the Philippines is ready to have a space medicine training program soon? What do you think is needed to have it soon?
So again, sir, sorry.
Sorry. Do you think the Philippines is ready to have a space medicine training program soon?
I think yes, sir, because one of the needed field in space medicine is So not needed. So it is a multidisciplinary field. So especially in rehab and orthopedics now is emerging different new innovations. Uh, so I think sooner or later we will be ready in uh, starting our space medicine here in the Philippines.
Okay, thank you, Doc. Another question.
Yes, po.
Is RTU including topics related to basic space medicine in any of its subjects under BS Astro and MS Astro curriculum anytime soon? Well, siguro ako yung sasagot. um, siguro po if we can have Doc Alcantara and Dr. Lee in RTU to have the subject. So siguro po, yes, we can have for the next batch of curriculum revisions. Maybe we can include it. So maybe we can have it soon. Ayun
Yes,
po.
and also this semester, Sir Ryan, in astrobiology, sir, we incorporated some topics about space physiology and anatomy, sir, in astrobiology for BS Astro program, sir.
Thank you. A question from Miss Marieta Concepcion Monton. I'm planning to become a neurosurgeon as my specialty in medicine.
Okay
Can
po.
it be applicable or do I need to become an internist or cardiologist instead?
In neurosurgeon, first, first, syempre, graduate, first you have to finish medicine, then your residency training should be general surgery first. Then after your general surgery, you will proceed to your fellowship program in neurosurgery. So in fellowship program, you will focus only in operating neurological cases.
Okay, thank you. A question again from Dr. Lee.
Yes po.
Knowing something about space medicine is good for our students, but to fully understand this topic, they need to have some background knowledge in human anatomy and physiology. What do you suggest to RTO Astro department to make this topic more understandable and put to practical use for for its students?
So for better understanding, sir, I think we should have two biology classes or preparation for the BS Astro students, namely the biology for the bacteria or general biology for the bacteria, etc. And another one for human biology and physiology. So with this preparation, sir, I think we can prepare these students in understanding more about space physiology and medicine. So for practice, I think the NASA opened some of their data regarding the astronauts. So as for practice, so I'm writing my research about the effects of gravity in our baroreceptors. So what can we do is, for example, we get the vital signs, especially the blood pressure and the heart rate of these astronauts. Then we will correlate this with the gravity. So we will, upon correlation, we will check the changes in post-flight and pre-flight. So these are one of the things we can do to apply this field. Also, the basic diseases that can be managed, the motion sickness, cough and colds. So we should give them some ideas on how to manage these diseases. So thank you.
Thank you, Doc. Another, how long in space before astronauts start to experience symptoms of psychosis? Given with this problem, how are the medications and treatment regimen different from a travel to planet Mars?
So again, sir,
Ulit. How
psycho.
long in space before astronauts start to experience symptoms of psychosis? Given with this problem, how are the medications and treatment regimen different from a travel to planet Mars?
So first, we have to remember that these astronauts are well prepared, not only physically and but also emotionally and psychologically. But again, there are cases we can control the emotional and psychological problems of these astronauts. So that's why they prepared these medications and live calls from the doctors and physicians. So from the researchers and from the research I've read, so they experience this psychosis for about their third month in space. So for about 90 days, they start to experience this depression. Some of them experience anxiety. So with regards to travel to Mars, so as we know, the travel to Mars is around will be around 6 months of travel. So I think the doctors or the space doctors should prepare them properly. And I think when they will send people to Mars, I think they will also get a one space doctor for the team to support them in the travel.
Thank you, Doc. Marami po tayong nakalinyang questions. Okay. Next po is from Mr. Romel Alindao.
Sige.
Sir, I'm interested about mutation of cells of astronauts who have stayed for several months in space. Can you give us more information about it? Thank you.
Okay, I forgot to mention about the radiation. So first, let's discuss about the radiation. So the radiation in space were really fatal to our cells. So what the NASA or the space agencies prepared is protection via the space station, protection via the space suit, and another one is they sent a probe which monitors the radiation flow. So we have this thing called Van Allen belt of radiation. So there are probes sent to monitor the outflows of this radiation. So by these things, so like when doing EVAs, so before doing the EVAs, they also plan first the upcoming flow of the radiation before sending the astronauts to spacewalk. So what are the values we have here for our radiation? So our normal chest X-ray is the radiation value is about 40 to 60 kilo EV. So another one, the radiation therapy using cobalt material. So it is around 1.2 mega EV. So it is quite higher compared to just a chest X-ray. So how about the radiation outside? So we have this galactic cosmic radiation. The value of its radiation is about 300 to 3,000 MeV. So as you can imagine, versus our chest X-rays here, having the value of 40 to 60 keV versus the 300 to 3,000 MeV, that is very fatal. But again, this value is generalized value for galactic radiation, no shielding, and only by solar minimum. So it is important also to monitor the flow of radiation. So what does the radiation does to our body? So the radiation emits different molecules or atoms, especially photons. So these charged particles affects our DNA in time. So in chronic exposure, or just like what the astronauts are experienced, they are exposed for more than 100 days. So there are chances of these photons damage parts of the DNA. So when this DNA are damaged, so this is when the higher the chances of gene mutations. In turn, this mutation can cause cancers. just like here just like here on Earth, the radio technologies are exposed daily. So there are studies like for CT scan technicians, there are studies like the 6 months exposure. You should have a physical examination for that time because of the amount of radiation. Knowing that the radiation of our devices here is too low compared to our radiation outside. So there could be a gene mutation that causes cancer for astronauts.
Thank you, Doc. Last question po
Yes.
from sa ating Zoom chat. Okay. Last
Okay.
question from Mr. John Jasper Raquel.
Okay po.
Ask ko lang po, is it possible to give birth in outer space? If so, what are the possible consequences of giving birth?
So that is one of the field in space medicine or they are having problems yet. We call it OB space medicine. So as we know, first few space flights are all male astronauts. So in modern times, they only added female genders in the astronaut list or the rosters of astronauts because they have the fear of conception in space. Not only, let's discuss first the menstruation. So the menstruation in space would be messy. We don't have ample amount of water. They only use wipes in taking a bath, cleaning. So what they did to the female astronauts are they give them pills to prevent these problems. So imagine they are infertile for about 3 months. That's why these things will not yet happen. So in cases that these things happen, or there's a pregnant astronaut or accidentally sent to space, so of course, I think we can deliver it there because there are equipments prepared, but for the baby, so for the baby, the problems will occur is concentrated, especially on the baby's heart. So, as what I've mentioned, there are the effects of gravity on the heart is very noticeable or intriguing because the gravity affects the baroreceptors. So what are these baroreceptors? So these are the receptors in the body that helps regulate our vital signs, especially the blood pressure and the heart rate. So the baby may survive the zero gravity because slowly it may be capable in adjusting the zero gravity. So the problem is when you return the baby here with gravity on Earth, experiencing gravity, because if just what like the astronauts experience, some of them are experiencing fainting upon going home because their hearts are adapted or adjusted in space. So what happens to their heart is some of the astronaut experience heart enlargement. So if you can imagine that child grew or survive in zero gravity. So the problems will occur when the baby is resumed to a normal gravity.
Thank you, Doc. So maybe now we can proceed with questions from our FB page.
Maraming salamat po, Doc Marvic. It seems that we have lots of questions and inquiries from our audience in the Facebook Live. Let's hear some of the questions from through Miss Francie Castillan and Miss Margaret Custodio. Um, Hello, Miss Francie and Miss Margaret.
Yes, hello. Good morning to all.
Yes, good morning po.
Sir, we have a question from the Facebook page po ng
Okay po.
card from Lance Charlemagne.
Okay.
Good day po. I'm a college student currently taking up astronomy. Can I still become a space doctor? What path should I take po after graduating? Thank you po.
So your path, so you are taking BS Astronomy. So there are universities here in the Philippines who are accepting uh, bachelor's degree, like in De La Salle Medical HS, DLSM HSI, they are accepting different students from different backgrounds. So I have batchmates who graduated medicine, who is also a civil engineer, IT. So you can try to apply in uh, HSI first. Also, there are some universities also that accepting this bachelor's degree. So after medicine, so you can proceed in choosing different fields such as what I have mentioned before, family medicine, internal medicine, emergency medicine, rehab, ophthalmology. So space medicine is multidisciplinary. So there are, you can choose different fields before proceeding to your fellowship in aerospace medicine. So I suggest you, if you want to, so you should inquire now. So after inquiring to you should plan ahead on what residency training program, because residency training program is very difficult. It's time consuming, energy consuming, so you should choose it wisely. So there are residency programs who you will take in for 5 years, like most surgical fields have 5 years of residency program. General surgery, ENT, orthopedics, those residency training programs are 5 years before you finish it. So what are the 3 years residency training programs? Some of them, namely internal medicine, family medicine. So you can saves time if you choose a shorter residency program. But if you want to excel in surgery, because most of the trainings in aerospace medicine is flight surgery, so might as well you proceed to general surgery. So thank you.
Sir, another question po from us po. We've been curious, sir, how blood circulation changes while in space po.
So in blood circulation, so in on Earth, our blood circulation. So first, the heart pumps the blood in different organs. So in all directions, but in all directions to the brain, organs, extremities. So it delivers it properly. So what happens in space? All of the fluids, especially the blood, is pulled upwards to our upper extremities and our in our brain, in our most importantly, the blood and the fluids are concentrated in our upper side of the body. So that's what happened in our fluids in our body.
Okay, sir. Sir, another follow-up question din po. Nagsishrink din daw po ba yung tissues and tendons?
So for the tissues and tendons, so sa studies for tendons, they are not concentrating on tendons mostly, but for the tissues, they are more concerned with the bone tissue as what I have discussed, and muscle tissues, also the heart muscles. Those are the three main focus of the tissues. So for the bone tissues, as what I have said before, there are problems occurring. So we call this the disuse osteoporosis because of the lack of weight-bearing activities in our lower extremities. So the normal homeostatic bone formation, bone disruption balance is disrupted. So we can surmise that their bones are brittle because of these imbalances in zero gravity. So for the muscles, they are atrophied because of lack of movement. So next thing is our heart. So studies shown that the hearts of astronauts are enlarged due to first the fluid overload of the heart, because the most of the blood stays in the heart because of the gravity. The heart wasn't able to push it in our lower extremities. So what happens? Uh, the heart is flooded, so the tissues got irritated by these fluids, and the heart masses or the tissues of the heart are now inflamed. So what happened is they are hypertrophic heart diseases encountered. So tawag nila dun, iba mega heart, ganun, lumaki yung puso nila. So ganun yung ano nila. So that is what happens to our tissues. So another one, the effects of radiation. So some of the tissues are affected and leads to mutations. So thank you. Did I answer your question?
Yes, sir. That's sir, another, for the last follow-up question po.
Okay.
Lumiliit daw po ba yung lungs nila sa space?
So for the lungs, there were no studies yet about the decrease in size for the lungs, because the atmosphere of the space station is adjusted. So they have ample amount of oxygen, carbon dioxide, and other elements needed. So also they have exercises provided. The exercises is not only for the muscle and bones, but also for the metabolic activity of the body. So the metabolic activities includes the function of the lungs. So the lungs is also exercised when doing those things. So there are also as what I have said before, we have oxygenation there in space station, but they can't expend it too much because it is so much expensive to deliver oxygen in space. So did I answer your question, ma'am?
Yes, sir. Thank you, sir. That's all po.
Maraming salamat po, Doc Marvic, for your very active response to the questions of our audience from Zoom and also Facebook Live page. Anyway, once again, I would like to remind everyone to answer the questionnaire in exchange for the certificate. And also, we will have a group picture taking in Zoom. So please turn on your cameras later. Moving on to award the virtual certificate of recognition to our resource person, may we please have Dr. Ruby Ann de la Cruz, our Associate Professor of the Rizal Technological University.
Hi. So the Center for Astronomy Research and Development of Department of Science and Technology and Rizal Technological University presents this certificate of appreciation to Dr. Marvic John C. Alcantara for imparting invaluable passion of scientific knowledge and development during the AstroCHATS, Human Anatomy, Physiology in Space, held this day, September 12, 2020, signed by Associate Professor Ryan Manuel Guido, the Program Officer of the Center for Astronomy Research and Development.
Thank you, ma'am.
Ayan. And to conclude today's Astro Chat, may we please call on the Project Management Officer of the Center for Astronomy Research and Development, Dr. Catherine Tria. As we wait for
Yes,
her.
hi, good morning. Hi. Okay, good morning. And first and foremost, I would like to thank, of course, the Center for Astronomy Research and Development for having this kind of chat. It's very informative. And of course, we would like to thank Dr. Marvick John Alcantara for imparting to us a very important details and a very interesting topic. Sir, thank you very much for the time and for granting our request and also for answering the queries of our audience. We do appreciate that. And also with the new normal, no, in the Philippines, that doesn't basically stop us, okay, to discover more knowledge, and that doesn't stop us to stop our um, interest in the so-called astronomy. Particularly, it's very interesting for me, the so-called space doctor, Sir Alcantara, no?
Yes.
It's very informative to me kasi business ako. But anyway, thank you, sir, for that very interesting talk and hope to have you again next time. Again, to all, thank you for the time spent. Good morning to everybody.
Thank you so much.
Maraming salamat po, Dr. Tria. And I request everyone to turn on your camera so we will have a group picture taking here on Zoom. Can you please turn on your camera and I will take a screenshot para ma-post natin ito sa ating Facebook Live. And hello. Ayan po. So, I'm going to take 2 batches of picture kasi sobrang dami po natin dito sa Zoom. Ayan, ready? I'm going to take a screenshot now. In 5, ready? 5, 4, 3, 2, 1, smile. Ayan. At isa pa po. Para sa second page. Ready? Smile, everyone. 3, 2, and smile. Ayan. Maraming salamat po sa lahat ng umattend dito sa ating first ever AstroChats. I remember back in my college days, every now and then meron kaming ganitong klase ng seminar. And I agree with Dr. Tria sa katulad nga na sinabi niya na the new normal, hindi tayo doon mapipigilan to share and impart knowledge. And thank you Dr. Tria and Doc Marvick and Doc Ruby at sa lahat ng bumubuo ng AstroChats na ito. And again, please, and again, I remind everyone to please answer the evaluation form para magkaroon po tayo ng ating certificates. And please, once again, I remind everyone to participate again next week. And once again, this is your virtual chatter, Mark Yao. Please subscribe to our Facebook page, facebook.com/rtucard, instagram.com/rtucard, and youtube.com/rtucard. And see you again next week for our AstroChats together with Mr. Miguel Artificio, the Administrative Officer of the National Planetarium. And unlike today, mas marami pa tayong aabangan sa next week at sa mga susunod na Saturdays. And we will surely chat you back next Saturday for our Astro Chat once again. September 19, same time, 10 a.m. to 12 noon. Goodbye, everyone. Bye-bye.
Thank you so much, guys.
Thank you po.
Thank you po.
Thank you, guys.
Thank you po. Thank you po.
2, 1.